But let's continue now to another story we are tracking for you today. There have been mixed reactions following the announcement that President Cyril Ramaphosa will tomorrow, in fact, be signing the NHI Bill after it was approved in the National Assembly last year in June. The bill seeks to ensure that all people access quality healthcare, regardless of their socio-economic status. All right, now let's discuss this further. Let's bring in Asiphe Funda, attorney at Section 27. Thank you so much for your time. So we know, of course, that this bill, has faced criticism from a number of fronts, political parties to some quarters of the private sector, with many saying that the legislation in its current form is the problem and will, in fact, limit instead of improve the healthcare system in South Africa. Just your reaction to what we're likely to see tomorrow.
Thank you so much for having me. As an organization, we are quite surprised that the legislation will be coming into effect tomorrow. We were still hoping for further engagement on some of the concerns that have been raised by civil society as well as public healthcare users. So there is a form of shock from us, as we don't think that the bill in its current state is ready to be implemented.
What for you stands out, with what is wrong with it? We know, of course, that universal health coverage is not unique to South Africa. Some countries have done it well, some have not. How can then South Africa ensure that the implementation of the NHI, which we'll likely see in a couple of years, will not further exacerbate the existing challenges within our healthcare system, do you think?
It's important to stress the fact that as an organization, as Section 27, we support the principles upon which the NHI is based on. And we acknowledge that the current system in its current form is not sustainable. We cannot continue with a two-tier system, with a public healthcare system that services so many people and is on the brink of collapse, and a private healthcare system that services about 16% of the population. However, the bill will be what will give effect to, or what will translate to, the healthcare system that people will get to experience in South Africa. Some of our key concerns are the governance structures. Currently, it is unclear how institutions such as Parliament will have an oversight role into the implementation of the Act, as well as on the bodies that will be created by the Act. Most importantly, there is so much power concentrated in the minister based on the Act. And we have seen that our ministers are not immune to corruption. Currently, the Act mandates the Minister of Health to appoint the board of the NHI Fund Board, to appoint the CEO of the NHI, as well as representation of civil society and actually state healthcare users is not clear. Yes, there is a stakeholder committee, but it's unclear what the role of that stakeholder committee. The main committees that have a critical role of creating the benefits, or rather advising the minister on what the benefits of the NHI will be, as well as the pricing of the services that will be offered by the NHI, do not have representation from civil society as well as healthcare representation, healthcare user representation.
All right. So, just from your vantage point as Section 27, we, of course, have seen the shortcomings. We've seen how doctors in this country have taken to the streets because they are unemployed in a system where, we need doctors and nurses, especially in the public system. We've also seen, of course, the likes of your organization and others, protesting around funds that are not being used for oncology patients in Johannesburg or Gauteng in the main. Just bring us into speed in terms of what are some of the challenges that you're directly faced with now in terms of trying to get government to up its game.
The biggest challenge, to be honest, is the ongoing de-investment of healthcare in South Africa. What we've seen as a continuing pattern is the state taking away money from the healthcare budget. And this has a crippling effect because it means that with less money, there's less money to buy infrastructure or maintain the infrastructure that is available. There's also less money to hire as many doctors in order for us to improve the healthcare worker to patient ratio, because we cannot have one doctor to 200 patients. That means more waiting lines, and actually also causes instances of negligence within the healthcare sector, because our healthcare workers are exhausted. And also, it would help curb the chronic understaffing that we have. So we have this issue of the healthcare budget being de-invested into. And a major part of that is corruption as well as irregular expenditure. So those are the pertinent things we need to be fixing. Yes, we hear proponents of the NHI Bill saying that bringing more money into a single pot of a single state healthcare that will provide universal coverage will tackle those issues. But how? We are speaking about access. The main question we have, as well as Section 27, as other people in the public, is if access is still an issue in remote areas as well as townships in South Africa, and the NHI seeks to have people use the system based on geographical location, it means that we will still have the same issues. A person in Ofimbaba or Philippi who does not have access to a clinic will still not have access to a clinic, because according to the strict referral system, they need to go to the clinic that's nearest to them. And if it is understaffed and the infrastructure hasn't been maintained, they will still be facing those issues. So we need more clarity on how the NHI will address those issues.
And a lot of people will agree with you on that in terms of just some of the questions, the glaring questions that have been asked in terms of how government will address them is very important. But thank you so much, Asiphe, for your time this afternoon. Of course, Asiphe Funda is attorney at Section 27 as we continue to get reaction, of course, following that announcement that President Cyril Ramaphosa will be signing into law the NHI bill tomorrow.